What is inflammation? This is your body's natural healing response, and typically we talk about being anti-inflammatory, but this is very context dependent. If you are actively recovering from an injury, your body is going to instigate inflammation to drive the healing process. If we try to then eliminate inflammation too early, we're in the acute injury phase. If I'm actively trying to diminish inflammation, then my body's ability to heal is now compromised. The big thing here is that we need to understand there's acute inflammation and there's chronic inflammation. Chronic inflammation, when we're talking about what does that mean? Chronic, don't even know what that is. Chronic is where things are troublesome because that can last who knows how long, but we want acute inflammation for healing an active injury. Now your body does this in a few ways, and I want to go a little bit into the in-depth, but this, you can have whole textbooks written on this stuff. We just want to cover a specific aspect that kind of makes the point of why is chronic inflammation really bad and something that we want to steer away from as much as possible. So inflammation is how your body heals. So you have either an invasion inside your body, so bacteria, virus, some kind of pathogen, fungus, mold, all that stuff, and that creates an acute inflammation response. So your body's identifying, hey, there's something in here we need to get rid of, let's have an immune response. Or you have an injury, so I walk out a room and I bash my elbow into the door frame and there's a lot of bruising, right? And it hurts a lot. What's going on with this? So as soon as your body registers, hey, there's been some damage or there's something we need to get rid of, the immune system needs to become engaged, you're going to release a group of chemicals. So you have things called cytokines. Cytokines are chemicals released from the nearby cells, and they kind of tell your immune system to upregulate or downregulate. So this is immune system activation. So it tells your nervous system to be like, hey, we have an issue. Let's, increase white blood cell production. Immune system activation. And this, of course, is on a spectrum. It's not a case of your immune system is on or off. It's more on or it's less off. You also have a chemical, most people have heard of histamine, typically in the case of allergies, when you will take an antihistamine to decrease the uncomfortableness in your face, right? And sometimes they can be extremely painful and we need to take an antihistamine. However, histamine's function, it's a hormone, it's a protein, and what it does is it dilates blood vessels and it actually stretches them out to make them a lot thinner. And that's why you feel that stuffiness in your nose. You can't actually have an allergic response and therefore a histamine response anywhere in your body. So you can imagine what we're about to talk about happening anywhere else in your body and why that could be an issue. But they dilate blood vessels. And what that means is that, so white blood cells, we'll say WBCs, white blood cells have been activated. They know they need to be going to the site of injury or infection. So blood vessels can actually be dilated in the general area, and that helps your white blood cells to just simply permeate through those vessels so they can go more directly to the site rather than having to navigate through your entire circulatory system, maybe a few times, to get to the area. So it helps them to get directly there. So this kind of helps to provide access or provide quicker expedited access. Quicker access to white blood cells. And there are, of course, other immune factors. And then you also have a release of chemicals known as prostaglandins. These, everyone would be familiar with these in terms of taking things like paracetamol or aspirin, as they actively work to block the release of prostaglandins, because what do prostaglandins do? They create sensations of, there is an issue here. What does that mean? They create pain, heat, swelling. So, these are the reasons why you would take something like paracetamol, because they help to decrease the prostaglandin release. And so now you don't feel as much pain or swelling or, fever, which kind of goes along with the heat. So I do that, I feel better, now I can carry about with my day. However, if I am taking something like that, I'm effectively blocking the pain. What does blocking the pain mean? It means that your body doesn't know that there's a problem to heal, because pain is how your body says, here's a problem. If there's no pain, your body doesn't know there's a problem. If you cannot feel your foot at all and you step on a nail, you can have issues because you're not going to know it's there. Okay, so this is what happens in the moment. You've had an injury or you've had an infection. Your body kind of engages this stuff, and the pain, heat, swelling, this also helps to direct the white blood cells to the specific area. Direct white blood cells to the area. And you'll often be able to look at the site and be like, okay, that's inflamed, it's red, maybe it burnt a little bit, and there's pain. Okay, so these are the specific chemicals that come out and create that inflammation response. This, in essence, is what we call inflammation. And so your body knows that there's stuff to heal. The white blood cells will then get to work. And this will start to segue us into why a chronic inflammation response, because all that stuff, if that's technically chronic, that's not necessarily an issue. Necessarily. You still wouldn't want it happening because that's just extra work, extra resources being used. So what happens next? So white blood cells, also known as macrophages, meaning they eat big things. White blood cells eat damaged stuff. Damaged cells, damaged tissues, and also bacteria. They eat this stuff. How do they then get rid of it? So white blood cells create what's called the respiratory burst. This is where they create this little short localized burst of different chemicals that are extraordinarily reactive and would come into contact with either the damaged tissue that they've eaten up or the bacteria or virus, and it quite literally makes them dissolve. Respiratory burst. What do white blood cells release? And this is, again, they've eaten the thing and now they're going to dissolve it to get rid of it. They create what's called, there's three main ones that I'll talk about: superoxide, hydrogen peroxide. Isn't that bleach? Yeah, your body actually creates bleach. Hydrogen peroxide, and just because I know it off the top of my head, H2O2. And then you also have what's called hydrochloric acid, hypochlorous acid, which is the main component in bleach. Hypochlorous acid. I do not know the chemical formula for that. But this is stuff that works to actively dissolve proteins, dissolve cell membranes. You dissolve that, the inside just kind of spill out, that gets dissolved as well, and the stuff is destroyed, right? This is normally an internal thing, it goes about inside the white blood cells. However, if you have a lot of stuff going on outside the white blood cell, they can create the respiratory burst externally. Now, this is normally in a small, very localized, very controlled area, because these are inorganic compounds. They're not really they're not cells themselves, right? They don't really have a nucleus guiding their functioning. They are quite impartial to what they attach to. So these can destroy the damaged tissues. They can destroy the bacteria that are invading, that we don't want inside of us. They can also destroy your own healthy tissues. And that's why it's such a localized burst, and why it's such a big deal that it's very local. It's just there in that one little area. However, let's say we get to a point of the inflammation has become chronic, meaning the injury has technically healed. So you've strained a hamstring and you were told, rest up 8 weeks. So we spend those 8 weeks. We are just sitting down on the sofa all the time because we don't know how to do active recovery. You're just watching telly and you're eating garbage food, because everyone defaults to eating a bunch of junk food when they're injured and when they go sedentary, because you can't continue working out, and hey, you don't need to eat healthy if you're not working out, right? So we go through this. Things have technically healed, but your body hasn't really healed right. Things are still really stiff, still really weak. Your body maybe it gets stuck in a case of there's a lot of pain, there's a lot of swelling. There's still stuff in the body that needs to be healed. So your body continues to pump out the stuff over and over and over again. Now we have a higher probability, a higher chance of some of this stuff leaking out into your bloodstream. So remember, our lymphatic system, things can get stuck and congested in our lymph nodes. So you still have circulation pumping through because it's a vessel going through like a big ball. And if there's gunk to the sides of the inside of that ball, your body knows it's there, and the immune system is trying to get to it but it can't effectively. So it's trying to get to this respiratory burst. Now that's affecting your own healthy cells because it's happening way too much, getting out to your bloodstream, and now that's creating its own inflammatory response. And where would that happen? Anywhere and everywhere in your body now. So you have pain, in your left knee because of an issue up in your right shoulder, just as a made-up example. So this is why we want to be actively working to decrease inflammation, make sure that when we get injured, we heal that as effectively as we can, and we do not get into the situation that we are stuck in inflammation. How do you know that you're stuck in inflammation? A few things just off the top of my head. You feel tight. You don't have full range of motion everywhere. Sleep is garbage. So you feel like you're not getting deep sleep. You feel like you wake up and you feel absolutely miserable. You probably feel really stiff and tight. You feel really weak. Maybe you feel painful. Pain when you lay down. Pain when lying down. So, you get through your day, you feel fine generally, but then you get home, you sit down, you relax, you take that big deep breath of relief, like, yeah, I'm done with my work day. And then it's like, oh crap, I forgot my lower back is hurting so much. So, pain when lying down, that's what that says. And there's a whole bunch of other things. Like typically, do you feel 100%? Do you? Do you feel 100%? Yes or no? Do you feel like you are functioning at the best of your abilities? If not, you probably have some sort of chronic inflammation going on. This is typically down to lymphatics being just like stuck, being stagnant, and why we put so much emphasis on doing daily or even twice or three times, however, every hour on the hour, lymphatic massage when we're actively trying to recover from injuries, recover from chronic issues like this. Does that make sense? So that's chronic inflammation, very basic overview, and there's a whole lot more to it than that, but this kind of covers what I feel is really important for working with mobility stuff. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07-305-231-339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.